Hi, I'm Dr. Shaylee Rajput, and I'm a pediatrician at the University of Michigan. As physicians, we don't always really consider the link between politics and medicine. With respect to firearms and firearm safety, however, understanding the political climate surrounding firearm safety legislation is important. It affects how we counsel patients and the content of that counseling. In this segment, we will provide a brief overview of key legislation at the federal and state levels affecting physician and patient counseling, as well as legislation affecting storage of firearm devices.
The basics of firearm legislation. In this talk, we will review the national and state level legislation as well as laws specific to Michigan. Before we begin, why should current legislation matter to you? Earlier in the series, we presented the data that demonstrates how counseling increases the likelihood of gun safety. Now we are directing this talk to help providers navigate the current playing field of firearm safety legislation. We hope that at the end of this podcast, you feel confident in effectively counseling patients about gun safety and understand areas in which you can work with your legislators to make changes that will promote child health and safety in this country, your state, and your community. At a national level, there is no legislation or Medicare requirement about physicians asking about guns. The firearm legislation at this level is foundational. You must be at least 21 years old to purchase from a federal firearms licensed dealer, but only 18 years old to purchase from a private dealer. There are national regulations requiring a background check. However, each state has its variations on this law. Most important at the national level is that it ensures that a gun customer has not committed a crime that is punishable by over 1 year of imprisonment, use of illegal substances, and is not mentally defective or committed to a mental institution, or convicted of a crime involving domestic violence. In 2005, it became unlawful for a handgun sale to occur without providing a secure gun storage or safety device. However, this law includes various exceptions and does not require the customers to use their safety devices. As you can see, at the national level, there is merely a foundation set for gun safety. Much of the regulation then falls into the hands of the state. At the state level, there has been recent buzz around the role of physicians in promoting firearm safety. The key legislation that sparked the national discussion about a physician's role in promoting firearm safety comes from the Glocks versus Glocks case. In 2011, a Florida couple was asked about gun ownership. They refused to answer, and their doctor refused to see them again. Legislation was passed in what is now known as the Glocks versus Glocks case of 2011. A federal judge ruled that the law was unconstitutional in 2012 based on the First Amendment, but the state appealed in 2014 and won. The Florida law is still in place today and states that a physician is not allowed to ask or talk about gun ownership and document, quote, irrelevant gun information, end quote, in patient charts. The consequence? Heavy fines and possible loss of medical license. Since Glocks vs. Glocks, a number of states have tried to follow in suit, highlighted in blue, but have not yet been able to pass a law. This illustrates a trend towards an increase in gag laws, which prevent physicians from discussing gun safety. The discussion of firearms in the physician office revolve around firearm safety. There are two types of laws that all physicians should be aware exist that directly address gun safety: firearm safe storage laws and child access protection laws. Only a few states, seen in blue, have firearm safe storage laws. These laws vary in what is required and for what types of guns locks are required for. Massachusetts is the only state that requires all firearms to be stored with a lock in place. Please note, Michigan does not have any legislation about safe storage. In contrast to firearm safe storage laws, child access prevention laws, or CAP laws, directly protect against child access and address the consequences of improper storage. There are varying degrees of strength of laws set forth state by state. At their strongest, CAP laws impose criminal liability on adults who allow children to have unsupervised access to firearms. At their weakest, they simply punish adults who give firearms to minors. 27 states, shown in maize, have such laws. Again, please note that Michigan is not one of them. But do these laws do anything? The answer is yes. Studies have shown that child access prevention laws have been effective at reducing unintentional firearm deaths among children. A 2004 study evaluated the association between CAP laws and suicides among youth and found that such laws were associated with an 8.5 decrease in suicides among 14 to 17-year-olds. Another study found that in states where the law had been in effect for at least 1 year, unintentional firearm deaths fell by 23% from 1990 to 1994 among children under 15 years of age. So now let's focus our attention to the local landscape. To understand the firearm safety landscape specifically in Michigan, one needs an understanding of what the current firearm acquisition process looks like. First, Michigan requires you to have a permit issued by the police to purchase a handgun. This is not the case for a rifle or a shotgun. After the permit comes the background check. A background check is not always necessary with a rifle or long gun purchase due to the high cost of the gun and difficulty to conceal. The background check for Michigan residents is less comprehensive than many other states, and the loopholes in the check for mental health and stability is often cited. If you have a permit and pass the background check, both of which may or may not be applicable to rifles or long guns, Michigan requires that a trigger lock or gun case is purchased or present at the time of firearm purchase. However, no legislation enforces that the individual must lock his or her firearm. Previously, a basic pistol safety pamphlet and questionnaire were provided at the time of gun sales. This was eliminated in 2012. This pamphlet highlighted basic pistol safety, use and storage, transportation, and criminal and civil offenses. So now you've acquired a firearm. State law does recognize certain public places, such as schools and hospitals, as weapon-free zones. However, Michigan is an open carry state. This means that if people have a concealed pistol license, they may not conceal it in a weapon-free zone, but they can carry their firearm in a visible location. This is referred to as the open carry loophole, as a legal way for guns to be allowed at schools if they are carried where people can see them. There have been recent changes in Michigan's firearm laws. Recently, Michigan's Governor, Rick Snyder, has changed the definition of a firearm to not include air guns. This is closer in line with the federal definitions. Furthermore, he repealed a law that prevented kids under the age of 18 from carrying BB guns without an adult present. For pediatricians, this means encouraging children to keep the orange safety cap on the BB gun so police cannot mistake it for a real gun. In Cleveland, Ohio, the police shot at a 12-year-old boy who had removed the orange cap off of his BB gun. The police mistook the gun for a real firearm. This illustrates the importance and need for physicians to stay up to date with legislation. Your counseling can make a difference.